today was the last presentation for our course from the University of Global Campus. Today we'll be presenting the effects of breast cancer among African American women. To start with, I think that is a very, very great topic that I chose. I chose it for two reasons because it's something that I dealt with in my personal life, and I also feel like it's something that is very informative to my generation, especially black women, and to all women, but especially to black women because it is something that always occurs in our history. Not so much something that comes out of the blue, but it's mostly inherited, I believe. So I feel like the study of it should always be focused on, and it should continue because it's something that has happened for many, many generations. So as we get started today, we are going to talk about a few things: the effects of breast cancer on the body, how it is spreaded, and some things. This is going to be a very, very, very informative presentation, and I know it is to present it to the community. Well, while I did present this, I did go ahead and try to pre-record this and go back and make some changes to some things that I didn't like because I did have an audience, and the audience was my mother, who is a breast cancer survivor, and she has been a breast cancer survivor for about 7 years. So a lot of things that are punctual to my presentation and my paper have come from my mother. Have stood by her side for many years while and along with the fight of breast cancer, just to make sure that she is a well grooming and growing healthy woman. However, she has been my audience this whole time and helping me with the importance of things that I should always include when informing people of their health and their nature. I've always wanted to help people in a way that is more persuasive, more advocating for a person that doesn't know, and letting them know that there are ways to turn your life around. There are risk factors that we all face, but there are ways to turn life around. So let's go ahead and get started with some things. I know I didn't mention everything that we're going to cover today, but we do have a few minutes to go ahead and cover a few things and go ahead and get that out of the way, okay? Alrighty. So we're going to start with this beautiful cover page here. That is a description of a black woman here, and she does have a lymphatic lymph in her breast that she is holding to signify that she has breast cancer. Now, when it comes to breast cancer, that is something that always occurs within the breast, and it does have a lot to do with cervical cancer. Cervical cancer is one of the leading things that has to do with it. I'm not sure why it leads to the breast, but it is a start there. All right. We want to talk about breast cancer, and we know that it is one of the second leading causes of death in America. And by that being one of the second leading causes of death in America, that's 1 in 8 women. That's about 13%. That isn't a whole lot, but that does make up for a lot of women in our lifetime. And I want to say in January, about 2.5 years ago, when I was doing research on it was very highly thing that was happening in my community, meaning my mom's sister had got breast cancer. My great-grandma, she had been diagnosed with breast cancer. Around that time, January 2021, there were over 3.8 million black women that were suffering from breast cancer, and they were trying to figure out how to get engaged with treatment, how to finish treatment, how to figure out how things would be better for their life. But we also want to talk about breast cancer as being described a health disparity. It is because there's an issue with an outgrowing cell that's growing there. We always want to notice that there are things that help in our health that we may not pay attention to, especially women of color, when it comes to our diet intake, when it comes to the things that we are physically active in. Now, being physically active is going to be one of the number one things that help us here when it comes to breast cancer. It helps us get those blood vessels going. It helps us be active. And I want to say, I guess, ourselves, it's what with believing in ourselves, because when you've been diagnosed with breast cancer, no one wants to say, well, hey, my life is over. Hey, what are the things that I do now? Hey, we need to show signs of, we want to show life. We want to show growth. We want to show prosperity. And there has been a lack in health screening when it comes to women of color and all women when it comes to breast cancer, even myself. Every 3 months, I go and I have a checkup with my doctor, and they always ask me, hey, have you been doing your breast screening? If you haven't, it's all 100% to let us know so we can go ahead and get you checked out, because we do know your mother was infected with breast cancer, and I'm always truthful to them. I don't always get around to it, but I always make sure that I'm always on good nutrition. I try to make sure I stay on a great diet. The physical activity, I keep myself working with my 2 jobs. Yes, sometimes it is very, very hectic, but I always try to keep up with it. So moving along with it, we always wanted to understand where breast cancer is leading in the United States, how it affects women. There are things called the lymph in the breast, and many other different things that can help women when it comes to this. Black women usually are likely to die from breast cancer more than other races. Breast cancer is common in the black race more than it is in the white race, and I say that's about 37% higher. And I want to say on a 5-year survey of rare breast cancer, there has been 90% of that in black women and about 77% of that in white women. That's a lot. Didn't really know that it was that many until I took time to dig into it. Some of the advancements of breast cancers, always keep yourself active in a plan to see to the end. Always seek life. The advances of breast cancer is knowing, hey, I've been diagnosed with breast cancer. I need to know what are these things doing to my body, what I need to do to keep my body right, what are the effects on your body. Well, I want to say there is skin irritation, and with the skin irritation, there's swelling and redness of the skin. There is thick skin growing over it. So you may not notice that something is going on with you right along the way. You would have underarm swelling. That is one of the number one things I want to say to watch out for. When I was dealing with this with my mom, she really didn't know for a long time why when she would go to bed and she would wake up in the morning, why her arms would feel so weak or why they would feel so heavy. Maybe like she's been lifting weights, but she's been sleeping all night. Well, her conclusion with that, well, maybe I slept on my arms and maybe I need to sleep a different way. Well, we tried that and we noticed that something was definitely wrong because that wasn't working for us. You always feel weak and fatigued, and you may think that you're feeling weak and fatigued because maybe I haven't ate, maybe I have a headache, some of the things that we constantly go through as just regular people, regular human beings, that I need to eat for a certain time or I might get tired or fatigued. As it progresses, breast cancer may make you feel extremely weak and fatigued. Why? Because it's something that is always eating at you from the inside out. There will be breast pain, significant swelling, cracks in tissue in the breast, and there'll be a change in discoloration. So always watch out for the things that are going on with your body as a woman. I'll say one thing I like to do as a woman. Anytime I take a shower, I like to stand in front of the mirror with my robe, take off one side, put one arm up, look all the way down from my fingertips all the way to my breast, look down on my legs just to make sure there's no skin irritation, there's no difference in color, dryness, just things that we've mentioned going on with breast cancer. Why? Because these are things that can help us live a happy life. Other rates of breast cancer, it can spread, and that also depends on the stage of breast cancer you're in, because there is a 0 stage of breast cancer, which is the earliest stage, and I think that's the best thing that people can get to know breast cancer in the 0 stage. Hey, you went to the doctor for a checkup. The doctor came back in. He ran a series of tests. He wants to sit down with you after he's gone over all your lab work and say, hey, we have found out that you're in the 0 stage of breast cancer, meaning that we have found this little small lymph or the little small dot, and we want to go ahead and take care of that. That's the 0 stage. But sometimes people don't always find out in that stage. They either find out in stage 2 or 3, sometimes even 4, when stages that spread to other systems of the body, which are the liver, the lungs, the muscles, and the bones. Now, all of that seems to give your body a change once, you have to get into that level of you know what things that were going on with you. Now it is affecting your skin system and affecting your immune system. You may not know that tumors spread, and they spread lymphatically through the lungs and the liver. And if it is affected, you will receive chronic coughing, shortness of breath, other breath difficulties, just a lot of different things that happen with breast cancer in the body. So one thing we do want to take part of and capitalize on as black women or as women as a whole, some of the strengths and weaknesses. I would say a weakness, that poor diet. Sometimes when it comes to eating, we may eat the quickest thing that's possible to us. That may be fried food, not always the healthiest alternative. But what we have to do as a black race is always continue with things that we know that won't bring us health issues. We know that there's cardiovascular disease. We know there's always things that tend to deal deal with our health that may not always be healthy for us. We know that the lack of physical activity, whether that be walking around your neighborhood, walking to the mailbox, or just getting you some exercise, that always has to do with the interventions of breast cancer. Now, when there's no health screen at all, then that's something that we have to do something about, because sometimes there are some people in our community that don't have any health insurance, have not seen a doctor in 10 to 20 years. They deal with their sicknesses at home, and they don't know the serious illnesses that they are dealing with. So a lot of that has to deal with serious health insurance, a poor diet. All of that ties into each other in a way that we've all experienced. Now, some strengths I want to go ahead and talk about, because it seems like we're going to go ahead and run out of time here, and I want to make sure I cover as much information as I can, is improving the dietary intake and some of the behaviors that we face as a race. And I think a lot of that was very important because there's some great things that people tend to look over. I don't know why people tend to look over the most important things, I feel. Now, some interventions based off it. The main interventions we want to go ahead and improve true health and knowledge. Know the benefits of what's happening to your health. Know the risk factors. There have been so many different risk factors here. Let me see if I can get to my notes. I had a few bullet points down here from the first slideshow when I introduced what we're going to talk about, something that I want to talk about, some interventions. Yes, the genetics of it. Always understand what's happening in your genes, what's happening in your family. Get well known with the things that occur on the breast cancer. Be tested for it. Know what's happening in your family. Because having this information will not only impact the risk for cancer, but also impact your family members too. You always have to know what's going on when a person say, hey, I don't always feel well. There's a swelling right here. There's a softness in the tissue. Always speak out. Never speak on things that you don't feel like you don't know about because you feel like it's a dumb question. No question is a dumb question when it comes to your health. Always think about the theoretical frameworks, things that's going to emphasize the risk factors of your behavior. Black women are always twice likely to die in the same stage of the diagnosis as they are being in. They didn't know they had cancer, meaning some people find out that they have cancer. They don't live that long, 2 to 3 months, and that's tops, and it takes them out of here. Why? Because they don't even know the things that are going on to prevent the cancer in an early stage. Because sometimes some things are powerless to them. They haven't taken advantage of the boundaries that are to them. And I'm glad we have this time to go ahead and share some things because being that I didn't know that it was so high for Black women in my race or in my ethnicity to go ahead and have these issues with breast cancer, being that my mom suffered with it. It was just so much that we were going through at that time. Having the personal history of the non-cancer related diseases within the breast, these are some of the risk factors and some of the logistical things that happen to us. We always need to know whether we're young or old, what is going on with us. Always develop health and strength in your younger age so you can carry that along once you get into older ages. Different things with the community that I feel that is important that I want to go ahead and talk about really quickly before we wrap this thing up is the proper treatment. Always know the proper treatment and the survival rates. It's always likely for people to go ahead and get on these survival rates. Why? Because it's a higher chance for survival. No one wants to wait till the last minute. There is a transition phase that we call, I'm sorry, I can't think of that word right now. A transition phase where you go from knowing to establishing what is going on to health screenings, treatment, medicine, surgeries. Those are the different transitions in my personal life that I have been through with this disease. And I want you to know that it's a very ugly disease. And if we don't decide to capitalize on this, it's something that'll take us under. A couple more things I want to go ahead and mention because we do have a few more seconds together. It may be unclear exactly what are the differences between some of the cancers, but what we want to do is talk about them because they're important. Always know that your loved ones, their health history can be reduced when they're developing breast cancer. They can be reduced when they're developing any type of sickness, but what we need to do is go ahead and capitalize on it, know the risk factors, know what's to happen with it, know the transitions, know that you don't have to be alone. You as a community can come together and know the characteristics, fight for a better life, fight for a better faith. And with that being said, I thank you guys for the time that we did spend together, and as a community outreach, I always want to train people to know the different things that are happening in their life,